Hello, I hope you're having a great day. We're here at the Invito whiteboard, and today we're going to be talking about diabetes. We'll mention both type 1 and type 2 in this little section here. Medications. This is very important to learn about the medications, at least give you a little bit of an overview, and the dietary importance. All right, we have our guy Bob here, okay? And what's happening is Bob's taking in sugar, and I have a form of a star here. He's taking in sugar in various foods, carbohydrates. There's all different kinds of sugar, and that sugar goes into his body. So what's happening? A quick summary, the pancreas is producing insulin. Now, for this drawing here, I'm going to use a straw to explain insulin. Here's our cell, and here's our sugar in our body, okay, the stars. And what's happening is this insulin has become resistant to taking the sugar and bringing it into the cell, mainly because you'll see the westernization of the diet, meaning the modern world of eating. We overeat. We have tremendous amount of sugar, so we help the insulin become resistant. So we have this resistance growing here on the insulin. So what does it do? The body sends a message to the pancreas to make more insulin, to make more straws. The problem is all these straws are insulin resistant, so it's very hard for the sugar or the starch to get into the cell. It's very hard for the sugar to get into the cell. So what's happening is we have this constant mechanism happening here. Production of more, so we increase insulin. We get hyperinsulinemia, higher insulin levels, and it just keeps growing, and the pancreas keeps doing that. At some point, and this is with type 2 diabetes, mind you, I'm talking about type 2 diabetes, at some point we can squeeze the pancreas so much to produce so much insulin that it stops or it reduces its production of insulin. And now, this is when a type 2 diabetic would need to take insulin injections. We know that type 1 needs insulin injections because they're dealing with something totally different. Their pancreas is being attacked by their immune system. So I'm drawing these triangles here, and it's showing us attacking the pancreas. So the pancreas is having a hard time producing insulin. So type 1 is an autoimmune disease, and type 2 is hyperinsulinemia, insulin resistance, and then eventually leads into the need for insulin in the more advanced cases and as the disease progresses. If you look at three commonly used drugs in the world of type 2 diabetes, or oral, these are called oral hypoglycemics. They help to lower the blood sugar. I'm going to name them here. You have one drug called glimepiride, or Amorol, another name for it. You have another drug here called glipizide, or glucotrol, and another drug called glyburide, or micronase is another name for this drug. Okay, so what I want to show you is I'm listing all these drugs, and you can go over them on your own. But these drugs' main mechanism of action is to go over to the pancreas and to squeeze out more insulin. And at least in the beginning of diabetes type 2, we're already insulin resistant. So it's not that we don't have enough insulin. It's that our insulin is not sensitive enough to absorb these sugars. So why do we want to squeeze the pancreas so hard? Now, at some point, a type 2 diabetic can squeeze out so much insulin and put so much stress here on the pancreas that all of a sudden they would need insulin as a medication too. They may need injections. And this is for more severe cases because at this point they've worn out their pancreas so much that it doesn't produce, the islets of Langerhans, the beta cells inside the pancreas do not produce insulin anymore, and now you need to take it via injection. And that's why you see people taking insulin injections. So one of the other glycosemic drugs that may be better, one known as glucophage or metformin is the name of this drug, may work a little better because it actually has shown to help with some of the insulin sensitivity a little bit and be more effective in that way. So when we look at the type 2 diabetes, we have all these oral hypoglycemic drugs in the beginning, and then if it gets advanced, you can also have insulin injections. Now in type 1 diabetes, the problem is not necessarily an insulin resistance like we showed here. The problem is you need to produce more insulin because your pancreas is being attacked by your immune system, so it can't produce the amount of insulin that needs to be produced. So here I have my little triangles showing the immune system attacking the pancreas, and so we have a decreased production of insulin. It's an autoimmune disease, very different process, right? And in this case, you usually use the insulin injections, and there are different types. which allows the sugars to be absorbed at different rates into the cell. So it's kind of, and that's balanced. So you have your insulin injections and you have your oral hypoglycemics. Now, why did I go through that type 1 and type 2 overview? Because a lot of people don't understand how those work in the medications. Now, what I want to do is I want to show you the importance, how critical the importance is for dietary health in both type 1 and type 2. To me, it's everything. It plays a critical role. Now, do not stop taking your medications, but I'm clearing this up so you can see this. Here we have our wonderful patient, again, Bob, and he's taking in sugar, and here's our star, in various forms. The sugars are in carbohydrates, they're in corn syrup, they're in all various types of things, right? Now, the rate in which, here we are in his stomach, the rate in which the sugar gets absorbed into the bloodstream, okay, via the food he's eating, via the food, is called a glycemic index, meaning the higher this number is, the higher the index is, the faster the rate of absorption will be of the carbohydrate or the sugar that Bob, here our patient, is eating. So if we're eating products and foods that cause tremendous sugar in the body, they get absorbed quickly, like corn syrup I mentioned, because that goes instantly, is absorbed very quickly, or sugar products and carbohydrates. We have, and this is, we'll say we're talking about a type 2 diabetes, we have all this sugar coming into his body, all this sugar, and we have, the more sugar we have, and we have more resistance on the insulin, so we can't absorb it into the cell. And we're having a hard time getting that absorbed. So the very first thing we need to change is what we're eating, and we need a balanced glycemic control of our foods. And that's what the stupid diet helps you do. It immediately helps you to balance the rates, because when you eat higher quality foods and you eat foods that are of the right foods, you can begin to bring a lot of healing. And the answer we see with this is we look at the Pima Indians in Arizona. We have a border that lives on the Arizona side of the border, and we have another group of Pima Indians that live in Mexico. And the Mexico Pima Indians are eating more of their indigenous foods, and you'll learn all about this inside the stupid diet. The Arizona ones are eating the Western diet, loaded with foods that cause massive releases of sugars that are very high in the glycemic index. And what starts to happen is these Pima Indians that live on the Arizona border, they get obese, overweight, have a high risk of cardiovascular disease, have a higher risk of diabetes. And the ones on the Mexican border who eat closer to their indigenous diets do so much better, leaner, healthier, and they're helping by the diet that they're eating. They start making this insulin here become less resistant. That's how important the diet is, and it starts to help with the absorption of the sugars into the cell. Diet is critical. Diet also will increase the quality of the fats you're eating, so you'll be getting more anti-inflammatory. It'll increase your metabolism, so the metabolism speeds up. So it helps to shrink the fat that we're carrying. And the other really, really key component that I want to add to dietarian lifestyle here is how important the stupid diet is. It also helps you to control stress. Why? Stress is very important in diabetes. Let me show you real quick. Here's Bob, and he's got a lot going on in his mind as we do, and he's highly stressed, so he's got major stress. What happens? Over his kidneys here, he's got adrenal glands, and these adrenal glands start pumping out two key things. One, epinephrine. You've heard of epinephrine. And epinephrine causes his liver to pump out more sugar because the liver stores sugar and glycogen, so now it pumps out more sugar, so he has an increase in sugar in his bloodstream. But then it does another thing. The very center of that adrenal gland has something called cortisol. And what that cortisol does is it goes to the body and does two dangerous things. It makes that insulin more resistant. So we know that the more cortisol you have, the more stress, chronic stress, the more resistant that insulin receptor becomes. And so now you're pushing to the pancreas to make more insulin, because that insulin's become less receptive. And the cortisol does something else very dangerous. It makes it very hard to lose fat in the abdominal side and on our sides. We talk about those very dangerous areas of where fat gathers and causes major problems in our body. Listen to me when I tell you, diet is everything. Take a look at the stupid diet. It'll help you so much with controlling the proper dietary intake, control stress. We talked about that. We talked about the proper parameters of how to eat, because much of diabetes, especially if you're pre-diabetic, especially if you have type 2 diabetes, can be of tremendous help with you. And even if you have type 1, you reduce the stress of loads of your body. Now make sure you're under care of a doctor, because as you start making these dramatic dietary changes and other lifestyle changes that we recommend, you will see good improvements, but you need to make sure that you're under care of a physician. Thank you for joining me today here at the Invita Whiteboard. A lot going on here with diabetes, the medications, the dietary background, but I hope this gives you a snapshot of how important dietary health is.